Hi, it's Dr. Chris Gubbels here from Square One Health, and today I am excited to introduce a special guest. I have a good friend and mentor, Dr. Curtis Martin. Dr. Curtis Martin is a chiropractor who's been practicing in California for over 20 years. Him and his wife successfully managed three different clinics in California in the Eastern Bay Area, and he has become a well-known expert in soft wave therapy. So I wanted to bring him on today so we can talk to him, introduce him, and really just interview him about some of his knowledge and experience in using soft wave therapy in his clinics.
Thanks, Dr. Chris, and I really appreciate that. And thank you so much. And I'm excited to speak to you and your community of patients. We've had nothing but great success with Shockwave, and I'm just excited that I get to share some of those experiences today with you.
Perfect. So can you tell me a little bit more about just using SoftWave, what you found successful, and explain to some of our patients, really how SoftWave works and how it gets the great results that it does.
Yeah, absolutely. So I came to get Shockwave as part of my own therapy. It was almost 3.5, 4 years ago. I had a really bad injury to my spine and was looking for alternatives in the stem cell world. And I found Shockwave, and I remember, Doc, it was the first time I used it, and it was a 50% reduction in my pain. So I personally have a personal story with it, but then I started to dive in deeper and go, well, what is it? And the special energy, and I think what sets this apart from any other therapy that I know, is when it uses this special energy of a hydroelectric shockwave. It's about 1/10 of lithotripsy. And it goes into normal tissues, passes right through, but when it finds damaged tissue, that truly is where things kind of wake up. And it does three things really well. The blood flow gets tripled. It helps recycle those old cells. And then the last thing it does, it really activates and stimulates your stem cells. And it does this over top of the skin, so it's not invasive. And it really is quite comfortable to get the therapy done. So no matter what the patient may need, whether it's bone cells, muscle cells, cartilage cells, ligament, tendon, whatever is in that area that's not healing, that's what gets woken up and starts to heal. And it's incredible. So that's why I'm so passionate about it, my own personal story, but that's really what the magic does. And it's been around for a couple decades in Europe, and now it's in the States, and it was only available to the elite sports teams, celebrities, and now it's being, available in all the communities. And I know you're one of the first adopters, so I think there's less than 600 machines in the entire United States. So I'm very thankful that you got one to give those options to your patients. Very exciting.
Yeah, and this is it was the perfect instrument for everything that we're trying to do. And it fits in line with why we created our medically integrated clinic. Because like you, I had an injury. I was in a ski accident, and that led me to doing a lot of the therapies, but I had to reach out to other things like regenerative medicine, PRP, and some stem cell injections into my shoulder. But it's interesting, I still had some problems because there was one part of my injuries that those couldn't address that the soft wave helped me with, and that's to help get rid of some of the damaged cells and break up scar tissue. And I can tell you, more recently I started training for a triathlon, and I never really swam before, but having to do the motions, I was getting some impingement syndrome. And using the soft wave, it helped me get this last 10% that I couldn't get. It was with PRP and stem cell, and now I'm 100% symptom free.
Congratulations. That's awesome. That's what it's all about. It always reminds me of different patients, or not only mine and yours, but I've seen so many patients. I had a patient that came in with double canes, two canes, and she could barely walk. It looked like she shuffled, and she was in pain every single day with medication. And the first time we did 500 shock waves as a mapping session, like a first session to see if it was going to help, she got off the table and she looked at me and she started taking a couple steps, and without the canes, and she started walking around, and she was like, in one treatment, it wasn't pain-free, but she was able to move without the canes for the first time in years. So that's why I'm excited about all your patients that, maybe they're getting that last little bit, or maybe they got a new injury, or maybe they know somebody with an injury. This soft wave, the therapy is just incredible, just incredible.
Absolutely. And we're finding sometimes this is the only thing we need to use, and sometimes we can use this in conjunction with other regenerative medicines to enhance and even get better results. And that's even what some of the research is starting to show. Using those in conjunction can even get better
Yep.
results than those on their own.
Yeah.
You mentioned something that I really want to talk about, because you mentioned something called a mapping session, because this is
Yep.
not only a tool to treat, but it's actually a diagnostic tool. So you can help, talk about how it helps you identify where the pain is coming from, so you know how to make the treatments more effective.
Yeah. So the device, when we use it on a first session to see if it's going to help, and I know that probably a lot of people listening are like, okay, I want to try it on my shoulder, I want to try it on my knee. When you use the device and as it's moving around, that sound wave, it passes through normal tissue, just kind of almost like a pressure that goes through. But when the cell is damaged, you can actually, it'll do what's called a biofeedback back to the brain and go, ooh, that's a little sore. And it lets the provider know, us, but also the patient know there's a problem in there. And that happens typically about 70 or 80% of the time. When we run it over a damaged tissue, you will get a response from it. And it lets us know that this therapy is going to help you, which is pretty incredible. So there's a lot of really great benefit from doing that first session. Not only people feel better, but also to let us know as provider, this is really going to help them, which I know that's on our heart. We always want to help our patients.
100%. We always want to make sure we're giving the best treatments so they get the maximal result. And that's one of the great things. It helps us find out, one, is a person is a candidate for this treatment, so we know we're recommending something that's going to help them. And then two, 60 to 90% of people get really good relief. I mean, some people get 100% short-term relief right away, but almost everyone gets some improvement, so we can tell if they're a good candidate for this treatment.
Yeah.
And one of the things that we've been trying to figure out is how are we going to introduce this, because we just started bringing in, and the interest has been overwhelming. And so what we are doing is we're actually setting aside some special times where people can actually come in and do an introductory mapping session.
Yep.
So if you're watching this and you're thinking, I have a knee or shoulder or my elbow, or there's a part of my spine, something that's just not healing and that's nagging me, and especially with, summer coming up and everyone wanting to be active, and whether it's golf or hiking, this is a great time to see if this therapy could help you. And so what we're asking people to do is just to contact our front desk, either by phone or email at frontdesk@squareonehealth.com, and let them know that you're interested in doing one of those mapping sessions so we can get you on our list. And then when we have some times open up, our staff can let you know, like, when we can set one of those up.
Yeah, that's fantastic. I'm glad you opened it up to your patient base first. I know that in our offices, the machine got pretty full before we started opening it up to the community. So I'm glad you're taking care of your inner circle first. And I'm just hoping and praying that everyone gets great responses and you'll see some miracles. So get ready.
Perfect. Well, thank you for joining me today. And if this is a therapy that interests you, like I said, just reach out to our office and let them know you're interested.
Yeah, great. All right,
Thank
Dr.
you very
Chris,
much.
take
Bye.
care. Thank you for having me on.
You're welcome.